Remember, there is no gym for your face. For the rest of your body, you can work out and tighten and whatever. But your face, there is no gym for your face. There is no yoga that's gonna lift and tighten your face. If somebody tells you that, please don't believe them. Hello everyone, this is Dr. Din and I am here today with my favorite Deysi. And Deysi is my ultrasound and Ultherapy tech and also my medical assistant who has been with me for over a decade. So Deysi is like an integral part of our community of experts who work with lasers and skin tightening procedures. So guys, welcome. Join me today as I get tortured myself. So listen, before I tell anybody else to go and get their skins tightened and lifted as they get older, or I would say as you go through time, also see, because we do what we recommend others to do. So again, your skin is the largest organ of your body. It is also the most expensive organ that you will ever possess. And one important thing to remember about skin is that it grows all your life. And as you go through time, and or should I say, as time goes through you, and as gravity goes through you, your skin loses its elasticity at some point and starts losing its elasticity, starts losing its content, and then guess what happens? At some point, the fabric loses its consistency and everything, and then you lose the shape, you lose the architecture of your shape, you forget how you used to once look like, unless you have pictures to compare your old self to. So now, for the first time in human history, what we also have discovered are some anti-aging medications and machines. So Ultherapy is another such machine that is there to basically help you keep the fabric of your existence, which is also known as your skin, together for a very long time. So this is something that we tell and recommend to all our people to not just do regularly, but also to do routinely once or twice a year, depending on where they are in the stage of life. So if you're somebody who suffers from menopause or who's already gone through menopause, just know that your treatments may be closer together. Does Ultherapy have any side effects? So like any other medication or machine, this is an FDA-approved machine for facelifting. It's a non-surgical facelifting tool. So it depends on who is driving your vehicle. So if this machine is used improperly, yes, it can damage your skin, like any other medication or machine. But if you know what you're doing and you follow the rules and procedures, it should not. So yes, it's very technician dependent. And the more experience somebody has, the better job they'll do for you. So guys, guess what? I am doing this today. I took my medication, so it hurts. This machine hurts. And the deeper we want to go in, the more it hurts. And Deysi is very well trained to hurt me. Deysi, are you ready to hurt me? She's like, yes, 2 thumbs up. No, I'm ready to get that. But the thing is that I like the way where I am in my life's journey. I like the way I look. I like the way it is. Everything is. And definitely I feel that this is what I look like. People, when they meet me, people who had met me in 20 years ago, when they come and meet me, they're like, yeah, you haven't changed. And that's what we want in anti-aging. In the realm of anti-aging, that's what we want. Am I ready for Ultherapy? No, I'm not. I am but I'm not. Like, am I looking forward to it? No, it hurts. So I really don't look forward to it, but I look forward to the results that it will give. So if I do it right now, I will probably start noticing results, some results right now. Deysi and I, we just took my pictures right now. And then most of my results and tightening will start occurring when I would have forgotten about this particular procedure. Usually, like, it's 3 to 4 months from now. Just also a very important question that people ask me, like, what is the difference between Ultherapy, which is like a machine that is created by a French company called MERS, and HIFU or something. And there are some other machines that are also in the market which use ultrasound based technology. I like the French company. Like, what is the difference between Louis Vuitton bag that you get from Paris, and what is the difference between the same Louis Vuitton bag and its knockoff that you get from China or from Chinatown in New York? So one of the things is that, there is like, I am that person who would want to go to the original designer facelift, non-surgical facelift. That's the one I like. That's the one they train you well. They have like a lot of. So this machine. Let me show you something. So this machine has transducers and different levels where we can target different things. And basically, we have to buy. It has expendable cost. So it is something that we have to buy the bullets from there and then place that energy directly under the skin. So very important tool, especially if you're going through perimenopause or menopause, or if you have gained weight, lost weight, gained weight, lost weight, which happens to a lot of women in their 30s during childbirth. So if you've gained weight and lost weight, and then you have like a little laxity happening in certain jawline areas or any other area, you could use a tightening procedure like this. Now, the one that I like is the one that is made by a French company. It's MERS. It's one of the, and I don't even have like one. I have two of these machines because I really love using these machines, because this machine, it just is one of those machines that keeps reproducing the results for you. And that's what you want. You want to recreate the result. It's the magic and miracle of anti-aging is not just getting there. It's just that journey. It's just that one thing. Remember, there is no gym for your face. For the rest of your body, you can work out and tighten and whatever. But your face, there is no gym for your face. There is no yoga that's going to lift and tighten your face. If somebody tells you that, please don't believe them. All right, guys, I'm going to start. I'm going to now lay down and tell Deysi before Deysi's like, I'm going to let me know when you are there. So I'm going to now tell Deysi. So Deysi, so because this is an ultrasound machine, for the sake of this ultrasound, she's going to put some gel under my chin, and I'm going to start with my chin. So I'll let you guys see my chin tightening. And is Ultherapy painful? Yes. You're going to watch me scream. Watch me scream. Do you recommend IV infusion with Ultherapy? 100%. That is a secret sauce. Infusion is a secret sauce for the dish. Yes, I am ready. Deysi, I was not calling you because guess what? I'll never be ready. But, yes. So she's she's done this several times, so you guys will be able to see what is happening. All right.
Is that the lower?
We are in yes, my chin. So one of the things I like to do is also to mark myself, but Deysi now knows some of the areas. So this is like, the drill of the foot. So just my full under chin.
What is the purpose of applying the gel?
So because this is ultrasound, it helps move the ultrasound transducer a little better.
Ready?
Not really, but yeah. So in the middle, We'll
You
start
start
from
the
the
middle.
middle, like the very, yeah, yeah, and press it, yes. So I like it a little pressed oh. So very soon I will not be talking. Mm, okay.
From 1 to 10, how painful?
Daisy, I don't like to talk, but mm, I took an ibuprofen, so it was 800 milligrams. So right now this is like maybe, ow, uh, 5 or 6 out of 10. But it's tolerable. I know the stuff that it is doing for me is more important, So this is the under chin. Now, under chin sag is very common in our lives because we are gadget people and we are always on our phones and gadgets, and we're always like our heads are hanging on top of our gadgets, and my head is also hanging on top of people that I'm working on. So I get like a very easy turkey neck. So I like to do at least my neck a couple of times a year, just because I don't like the sag that happens every year. And listen, I am in my 50s, so when you're in your 50s, you do not have much reserves when it comes to collagen building and keeping the structure of your skin intact by itself. The original manufacturer guarantee on your body is over by the time you turn 50. And after that, you're on your own. So, anti aging is a great tool for people my age. The reason I am holding this myself is like I know at which pressure it hurts less. So when Daisy holds this tool, I can sometimes, it, it's less work for my own hands. Okay, 1 second. I'm going to just show them one thing. So if you guys see, I she's just been doing over here. You can't see any redness or any there is no penetration, there is no needles. This is not micro needling. This goes to the bottom layer of your skin. That's where, so your skin has 3 layers. There is like the top layer, there is the middle layer, and there is the bottom layer. This machine is very important because it goes all the way down to the bottom layer and creates and deposits the energy over there, and that's the energy that tightens and lifts the skin. Oh, the anal therapy session. Well, it depends on how much. So if I have a lot of laxity, I will tell Daisy to keep doing it. But yes, there is like the session depends on how fast. Like right now, I'm talking to you guys, so we're going like a little slow because Daisy is not torturing me in public right now because we're live. But usually we go very fast, right?
Ready?
Yes. So I'll do like another layer in the. I know certain areas that, yes. Here. So this is targeted ultrasound. It's high frequency ultrasound. Yes, you can say that, but I like the frequency that the French company has.
Can you do it without taking medication?
Um, my own self, no. Like if this amount of pain, I can tolerate it with high dose ibuprofen. But I think that if I had to do it without the pain medication, it would be like a bit too painful, and I would totally not enjoy the process. Right now, I mean, I still don't enjoy it. I mean, I'm happy I can do it, and I'm doing it for myself. But I'm not dreading it right now because it's like, yeah, it's painful, but it's not intolerable. But yes, can it be intolerable? Yes, if you do not take medication. Oh no, there are people who have done it without medication, and well, hats off to them. I'm not them. I have low pain thresholds.
What is the cost of one treatment of the therapy?
So depends on who you're getting it from, and if they have the French machine or if they have the Chinese machine. If you have the French MERS company's machine and you're using their transducers and you're in United States, um, it should cost anywhere between $3,500 to $5,000 depending on where you get it, and how experienced your tech is. But you know, there are people who don't just do the full face, they just do certain areas. So if you do like, yeah, just an under chin, like what I am doing and showing you guys right now, if you do like just this part, this is something that we do for like around $1,500. So this is like, you know, just under chin, your tech neck. This is your tech neck solution. It's very popular not just in women but also men. Um, there's no downtime, so once I'm done with this, I'll just merrily go my way and do the rest of my life. There is nobody will be able to see. There is no swelling, there is no bruising, there is, you know, no other problems. One second.
Any aftercare that you have to do?
So personally, I tell my clients that please use that chin strap for a couple of hours every day, and that's very helpful for people. Otherwise, no. And then there is like a cream that the MERS people recommend to use with the neck and décolleté once you do the Ultherapy, because that just activates the skin very well after Ultherapy. So I do give that to people. But otherwise, no, there's no aftercare because it's non-surgical pretty much. One second. I just did my under chin. How much did I do? Yeah. So almost the amount of energy I just saw that so this is like around, I did a little bit over what I had to do, but this is what it looks like. Now you won't be able to see anything right now because already it is. I don't wait until it becomes too lax to retighten it. But this is the procedure. So now she's gonna do my neck. Then she's also gonna do my jawline, a little bit cheek. I want to do my under eyes. I'll also do it around my mouth because I don't want to do fillers. But one way to get like a very nice fillery kind of effect around your face is to do Ultherapy. So skin tightening around here. How long does pain last after treatment? So afterwards, since I'm gonna, when I do my jawline and stuff, so sometimes for 5-10 days, this area hurts a little bit because guess what? All this energy does go inside the skin and it does create like a micro injury around the around the skin's deepest layer. And as the skin heals, that's where it lifts it up and tucks it up. So that's why I do feel that sometimes for a week or so, you might be like a tiny bit sore, but it's a nice kind of soreness. Um, Is it necessary to mark the areas before starting with Ultherapy? So I do like to mark myself, but since me and Daisy, we know the areas that I was going to do. So she's done it so many times that she doesn't really mark the tiny areas, but we know, and I know where I was going. But if it is like somebody, because where I usually mark people when they're seated, and so that when they lay down, I know which areas I'm going to give more energy, which areas I'm going to give less energy, because not all faces are the same. So we don't give you a cookie cutter treatment. It's just like skin. Your skin is like a fabric. So just like everybody's body is different, similarly your skin, the way it should wrap around your body is also different and very highly precise. So yes, I always do IV infusion therapy with my Ultherapy. The reason I'm not doing it today is because I just got it done a couple of days ago. So because I just did it like 2-3 days ago, that's why I'm very quickly coming and getting my Ultherapy in, because I want both of these processes to come together for me. How do you determine if someone is a good candidate for Ultherapy? So if you are somebody who likes you, you like your face, you like what God has given you, and you are somebody who does not like getting cut by your favorite plastic surgeon, yet for whatever reason, maybe you do not have enough money, maybe you do not have 4 weeks to take off after surgery, whatever is the reason, at that point we offer you something like this. So a candidate, like pretty much anybody, see, the thing is that just like any other organ of your body is going to fail as you go through time and as you get older, so will your skin. And the treatments for skin are usually considered cosmetic, even though they have an impact on your psyche and the way you perceive yourself and the way others perceive you. So that's the reason that we recommend that these treatments should be tried out by anybody who has access to these treatments. So yeah, pretty much anybody can be a candidate. But yes, you don't need it when you're 20. You definitely don't need it when you're 30. Like, unless you have gained weight and lost weight and there's laxity that you're experiencing. When you're in your 20s and 30s, and even late up until late 30s, your body is still producing its own reserves. So if you do other treatments, like more superficial treatments like microneedling and stuff like that, they will also tighten and lift you. But as you get older, like in your perimenopause, menopause, post-menopausal stage, in your 50s and 60s, this is something that I would tell you to do. Now, if you've never done anything for, like, let's say, all your life, and now you woke up one day and now you're 55 and now everything is like fallen apart, and you say, oh shit, it's too late, I cannot really do something that's minimally invasive because it doesn't show me any results, let me go and go to my favorite plastic surgeon and give him all my money and get like a nice tight lift. After you have done that lift, just know that 1 or 2 years later, because your skin grows all your life, you will see that 3, 4, 5 years after your plastic surgery, also your skin will lose its elasticity again, and it will require you to start tightening. So whether you do this as a preventative measure from preventing yourself a surgery, then I would suggest do it earlier in life, and do it when you first start noticing signs of laxity. And if you are doing it later after surgery, then I tell people that even after surgery, you should still preserve the results of that surgery for as long as you can. And this is one of those secrets that people will never tell you about. Do you have any Valentine's Day specials? Yes, we do. We have a Valentine's Day special on Barbie Botox and on IV infusions. And I am not sure if I have something for laser, but I think that I may do like a laser thing also around that time. If I'm in my 20s, can I start applying IV infusions? For sure. Infusions you can do anytime. How do you do the liquid faces? So liquid facelift, so this is like a non-surgical facelift with a tool, right? So this is a machine, one of my favorite machines. But liquid facelift is when you use medications like Botox, which comes in the form of a powder, but has to be reconstituted when we get it and before we apply it in your face. So that is the liquid. And then also the hyaluronic acid fillers are also in a liquid form. They're like a little pasty little liquid that we place into your face, into the crinkles of your face, just to erase your crinkles and erase the march of time from your face, from your forehead, from your beauty, so that you can meet yourself in time completely intact and as beautiful as you can be. How experienced are you in Ultherapy? I am very experienced in getting it as well as doing it on other people. I have been doing this particular treatment. I've trained in it for over a decade. So, yep, I can do it well and very quickly. Guys, thanks for listening to me. Thanks for watching me get my chin, my tech neck fixed. If you have any questions about it, please comment on this video and follow us. And I hope that we can tell you more secrets about anti-aging and how to keep the structure of your face together throughout your existence. Bye-bye.